Hello and welcome. You're watching NDTV. I'm Sarah Jacob. You're watching NDTV on a day that India has crossed the 56,000 mark when it comes to coronavirus positive cases, and there have been 103 deaths that have taken place over the last 24 hours. So we're in the midst of this pandemic for sure. The numbers on the rise in India. What do you need to do to protect yourselves and your loved ones? As India is now in the lockdown 3.0, where the restrictions are being eased, we're having thousands and thousands of Indians now returning from all over the world back home as we cross the 56,000 mark. This is the show where we bring you the best in the business. Doctors who are on our show from all over India to answer your questions, your concerns, your fears about what we need to do to protect ourselves and our loved ones from the coronavirus. So, over 3,000 coronavirus cases, fresh cases reported for the second straight day. That means India's COVID-19 count is now over 55,000. As many as 3,390 people tested positive for the coronavirus in the last 24 hours. The total number of patients has increased to way over 55. The number of deaths due to COVID now at 1,886. And the Health Ministry today said citizens have to learn to live with the coronavirus. What exactly does this mean? Let's go across to our doctors today. On the show, we have Dr. Praveen Kalvit from Raipur. He is a consultant physician and diabetologist. We also have Dr. Ramesh Goel, a consultant endocrinologist, head of department at the Apollo Hospitals in Ahmedabad. So, Dr. Ramesh Goel, first to you, sir. You're in a hot spot in Ahmedabad as we wait for our callers to come in. Ahmedabad and Gujarat really has overtaken the other states like Mumbai in numbers. In the state that has the largest number of coronavirus cases, you're still working there in the midst of all of this. Your reaction, what is the situation on the ground first in Ahmedabad? Why are the numbers, in your opinion, given what you see around you, on the rise?
As you rightly said that we are coming towards the end of lockdown 3, and still we are seeing a lot of cases in Gujarat, particularly Ahmedabad, as well as Maharashtra. So first of all, the main reason which I think is due to increase number of testing and increase surveillance. So here what I see is that the number of tests which are being carried out by the health authorities has gone up tremendously, and this has helped us to contain the spread of the community spread of this virus due to this active surveillance and testing. So
okay.
I think in a way it is a good that the patients who are asymptomatic and even they can infect the community. They are picked up at a rapid rate, and they are isolated, they are quarantined. And so I think in coming weeks, the graph should come down drastically.
Got it.
That's what
so you're saying it is only obvious that if you increase testing, the numbers will go up. Nothing to be really alarmed about right now coming out of Ahmedabad. All right. We have Altaf Ahmed, a colleague in from Lucknow. So, Dr. Praveen Kalvit, maybe you can take that question. Go ahead, Altaf.
Good evening, madam. I just wanted to know the diabetes patients and hypersensitive patients who have been treated for COVID and they have been discharged, what is their immunity power? This is the first question. And one small question, what is the status of type 1 diabetes adolescents in COVID-19?
All right, so Dr. Praveen Kalvit, the best suited to answer this question. He's a diabetologist from Bilaspur. Go ahead, Dr. Kalvit.
So thank you very much for this question. Basically, the persons with COVID-19 and underlying diabetes disease, after having sustained infection, if they are discharged, they are to be extremely cautious about their blood sugar levels. It is very, very essential that every diabetic person takes care of his blood sugar level by routinely monitoring his blood sugar levels. And in a diabetic who acquires infection, the derangement in the blood sugar levels are very common. So maybe twice or thrice in a day, you are required to adjust your blood sugar levels to ensure that they are well within normal limits. And very insidiously, these blood sugar levels are also known to go astray. And that perhaps is the earliest sign that you are harboring infection. or maybe something is going wrong in your body. So you have to be on immediate alert and contact your treating clinician. When it comes to adolescent diabetes or type 1 diabetics, it's a very, very important situation because these children are extremely sensitive to any kind of infection. And the most dreadful complication in these children is diabetic ketoacidosis. So the thirst, the level of dehydration, the urinary ketone assessment, this is of extreme importance when we deal with patients with type 1 diabetes in adolescent age group.
Altaf, I hope that answers some of your concerns. We have lots of callers. I'm quickly going to go across to Mumbai where Mayank Desai is on the line. Go ahead, Mayank.
Yeah, my question is how the virus will behave in monsoon because it's not going to over within a month or two. So what is the virus behavior in monsoon season?
Dr. Ramesh Goel, what should we expect in the next few months?
So there has been a lot of talks and lot of articles on what would be the effect of increased temperature in the summers and increased humidity on the virulence of COVID-19. So I will say that the COVID-19 has not celebrated its first birthday still. So it's still very young. It has not seen summer or it has not seen the monsoon. So we really don't know how it will behave in summers and the monsoons. But having said that, COVID-19 is a virus from a large coronavirus family. And there are various viruses like the Middle East Respiratory Syndrome or the severe acute respiratory syndrome viruses, which belong to same family. So we have some knowledge how these viruses behave in different temperatures and humidities. So the study says that with increasing temperature, these viruses limit their spread. So the rate of infection comes down as the temperature goes up with the other viruses of the corona family.
Correct.
And as the humidity goes up, the virulence of the other corona family virus, it increases. So I think same can be extrapolated to COVID-19. But as I said, COVID-19 has not seen the summer and the monsoon yet. So coming weeks or the months will tell us how it's going to behave.
So it's a changing situation and that's why, Mayank, we'll have doctors like this, experts every day on the show because as the doctors here are saying, things keep changing. We have actually another doctor calling in, Dr. Ramana Rao from Hyderabad. Go ahead, Mr. Ramana Rao.
Good evening to all of you. My question is regarding my father-in-law who is 70 years of age. Just now he is recovering from stroke. Due to stroke, he has some comorbid issues like lungs and heart. Presently, he is having creatinine levels at 2.5. My question is, with this background, can he attend physiotherapy sessions? Somebody says, oh, he is most vulnerable for a COVID infection. Whether he can attend the physiotherapy sessions to recover from paralysis.
Dr. Kalve, did you hear that question?
Yeah, I'll be more than pleased to answer his question. Basically, look into the age of your father, who is 75 years. He already sustained a stroke, which in fact is one of the complications a person in the elderly individual is likely to get after suffering from COVID-19 infection. So having had that, it would not be prudent to take him to any hospital setup for undertaking any physiotherapy. In fact, you can hire a physiotherapist and he can definitely come to your place and he can do a religious physiotherapy for your father for early recuperance and early recovery. Going to institute for institutional visits or taking physiotherapy perhaps at this juncture in this age is little difficult bargain, I would say.
Probably too much of a risk right now.
Yeah,
okay.
Yeah, right.
Tej Bakshi from Panchkula.
Thank you, NDTV, for this great initiative. It's terrific to watch it in the morning and evening. I have a very simple question. Primarily, you hear, do you read the newspapers? Do you touch the newspapers or you don't touch the newspaper? Do you put them in the sun, let them dry, then bring them inside and read? Well, any of the doctors, could you please just advise on this?
Dr. Goel, a good question because I, for example, still aren't getting newspapers at home, but if they restart, I'd love to hear what your answer is.
It's absolutely safe to get the newspaper and I recommend that everybody should read the newspaper so that you get the latest guidance and the latest picture of COVID-19. Now, talking scientifically, a lot of research has gone into whether newspaper can spread COVID-19 or not. And the answer is no. And there are several reasons for that. That COVID-19 virus loses its virulence on porous surfaces. And the paper which is used in newspaper is a porous paper. The second thing is the printing, the process of printing, which is automated, and the ink which is being used in printing the newspaper, it sterilizes the paper. So there are very less chance, there are negligible chance that actually a newspaper can spread COVID-19. And just to quote out of the experience from China, US, and rest of the world, there is not a single case where COVID-19 was spread through a newspaper.
But
So
Dr.
it's
Goel, if I could
absolutely
just push
safe.
you further on that, if you're saying the coronavirus doesn't stick to porous surfaces, similarly then, food that's delivered, a lot of the food is delivered in, if you order food online from a restaurant and it's delivered in those cardboard boxes, would the same hold for that?
No. On cardboard boxes, the COVID-19 can survive up to 24 hours. So if you are ordering food from outside and it is delivered in cardboard boxes, I will recommend that you should follow the universal precaution that after touching the cardboard box, you should wash your hands with soap or water or alcohol-based sanitizer before you start eating. And once you dispose that box, again you should wash your hands with soap and water. So touching a cardboard box is equivalent to touching any other surface, and you should take the same precautions which you are taking with touching the other surfaces.
All right. Okay. T. Narsimha from Hyderabad has a question.
Okay, madam. Good evening, madam.
Go ahead.
madam.
Listen. Go ahead.
Good evening,
Narsimha.
madam. Good evening, doctors. Thank you for NDTV.
Go ahead.
Please go.
Good evening. Good evening, madam. Good evening, doctors.
Good evening.
Doctors, thank you for NDTV. Sir, madam. Okay. Thank you very much for initiating these steps. Madam, I am age of 51 years. I am suffering from diabetes for the last 10 years. Madam, medicines are not available now and then in Hyderabad. But can I use generic medicines frequently, sir?
Dr.
Could you please
Kalbit?
tell me? And another thing is that what measures I have to take in view of pandemic coronavirus?
So basically, Mr. Narasimhan, you have to realize that this is a pandemic and you are fighting an epidemic of diabetes. So it's a double-edged sword you are dealing with, but don't get frightened. In fact, the availability of medicine has been an issue for quite some time during this lockdown period. But then if you are able to get the same medicines by generic brands, I think it is absolutely fine. You can very safely, very comfortably and without hesitation go ahead with the same stuff. Secondly, you said what general precautions. For every diabetic individuals, 50 plus for that matter, you should observe what is called as a sick day rules. When it comes to sick day rules management of diabetes, you have to regularly monitor your blood sugar levels. You have to keep yourself adequately hydrated. You should routinely check your urine ketones to see that you don't go in dehydration and you don't go in any ketosis. And a very important thing you should regularly monitor is a rise in temperature. The slightest rise in temperature would put your diabetes into total disarray and put you more vulnerable for acquiring severe infections, maybe COVID-19 or maybe some other infections. So and secondly, you have to be utmost cautious about your own personal hygiene, like repeated hand washing and all those 20-20 is the rule. You have to wash your hands for 20 seconds and 20 times in a day. That would perhaps the best way to get rid of this possibility of infection by COVID virus. You have to be on alert. You have to be alert, and the most important precaution for you too is observe social distancing and be at home very, very comfortably.
All right. Syed from Mysore has a question.
Yes. Good evening, doctors.
Good evening.
My question is about the plasma therapy. I hope you guys can hear my voice.
We can. Go
Yes,
ahead,
clear.
Syed.
Yeah. Two questions I have about plasma therapy. If we remove plasma from the person who has recovered from the COVID-19 disease, then won't he lose the antibodies which he had produced fighting against the diseases? And second is, when you give plasma from person A to B, do the blood group have to be the same, or it can be of a different RH factor?
Dr. Goel?
Yeah. So, plasma therapy is one of the therapy under investigation for treatment of sick COVID-19 patients. And basically in plasma therapy, the plasma, that is the liquid component of a person's blood, is transfused into the patient who is suffering from severe COVID-19. And the plasma, which is collected from that from the person who has recovered from an acute bout of COVID-19 infection. So he has a high titer of antibodies in his or her blood. So the first question to be answered is that whether if we remove the antibody from the person who has recovered, he will lose the immunity. It's not that we just remove a part of the blood from his system. So major portion of the antibody still remains in the person who has recovered from the COVID-19. Only part of that blood and the plasma separated from that is transfused in acutely ill COVID-19 patients. And whatever appropriate tests are required before such a transfusion takes place, including the testing for the other viruses like HIV, hepatitis, is carried out by the hospitals, and adequate precautions are taken that there is no catastrophe because of the transfusion of this plasma. But having said that, this plasma therapy is still experimental, and since we do not have any short treatment for COVID-19, as a desperate measures, we are trying the plasma therapy, and in some centers in China and US, it has shown encouraging results. But as of now, it is not an approved therapy for COVID-19.
As you said, Dr. Goel, coronavirus hasn't even celebrated its first birthday, so we're learning to live with it and dealing with the things one day at a time. But let me quickly squeeze in one caller before we go into a break. Captain Mohan Kanuga joins us.
Hi, Sarah.
Hi.
Thanks a lot for letting me on your show and ask me this question.
Go ahead, Captain.
Hello. Yeah, Sarah, thanks for having me. I have this question for Dr. Praveen Kalwit. I'm a diabetic patient for the last 4.5 years, and when I was in flying, every 6 months we used to have a checkup. Now what has happened is, because of this pandemic, I was advised by my diabetologist to take Istamet 50, 500. But there's an acute shortage of this medicine, and I'm totally into panic and unable to contact my diabetologist for some reason. So this is a good opportunity for me to talk to an expert like Dr. Praveen. So I'd like to ask him, is there anything you would like to suggest and some extra precautions, because I'm 72 years old, diabetic. So how do you think I should manage my this time in COVID-19 pandemic?
Yeah, I understand your concern. Basically, let me tell you, whatever trade name medicines you are taking, Instamet 50 by 500, that is available by some other brands also in the market. This basically belongs to a group of drugs which is called as gliptins. And in India, fortunately, we have 5 or 6 different types of gliptin brands available, equipotent. You are 72 years, so you are very safe in taking these drugs, for the simple reason that these drugs are devoid of any hypoglycemic potential. When you said you retired from Air Force, I was wondering whether you are still a flying crew, because in that case, more stronger medicine would not have come to your rescue. But since you have already retired, you are off guard. I think at the age of 72, you can find another competitive brands, different brands. It would be improper for me to tell you the commercial names at this juncture, but anything in the form of sitagliptin, vildagliptin, linagliptin, along with metformin combinations, they are available, extremely freely available in every shop across the country, because most of the Indian companies are also manufacturing these drugs. So don't worry, reach out to your nearest chemist or reach out to a medical helpline online, and you would be immediately delivered these drugs. Be safe, stay fit, stay fine, and all the best to you, Captain.
I reiterate that, Captain. Thank you for calling in, and it's for viewers like you that we have these shows. We're so glad we were able to put you in touch with Dr. Praveen Kalwit right now to answer this question and your fears. Let's go in for a short break. We can take a few more callers after that, so let's quickly do that. Welcome back, Dr. Praveen Kalvith and Dr. Ramesh Goel in studio with us here on this show. I just want to give you the last word. Today, Love Agarwal, the Joint Secretary of the Health Ministry, said that we have to now learn to live with the coronavirus. So, your last words to this, to our audience today. What does this mean? What do we need to incorporate in our lives now? Dr. Goel?
Yeah. So, living with COVID-19 means you have to follow certain norms in routine life, which reduces the risk of contracting COVID-19, because prevention is better than cure, and we know there is no cure as of now for COVID-19. So what should we do for prevention? So first is social distancing. So whenever we start our routine, we should maintain strictly the rule of social distancing of at least 1 meter. That helps you to prevent coming in contact with the droplets with a supposedly infected COVID-19 person. The second thing is you should wear a mask. It's not necessary that you should wear a N95 mask. That is meant only for healthcare personnel and the people who are actively taking care of the COVID-19 patients. But a simple surgical mask will suffice.
All right.
Because it is an advantage that you don't come in contact with droplets of the others, and you don't spray the droplets on the other people.
All right. Let's see, Dr. Kalvith, anything you can add to that?
Yeah, definitely we have to understand, because the ultimate goal in effective management or devising an effective strategy for effective control of coronavirus is a safe distancing.
Yeah.
We have to understand at this point of juncture that if the virus doesn't get any live host, that if you don't come in proximity of less than 3 feet from in contact with any person who's actually suffering from COVID, then even if that virus falls on the ground or on any other surface for that matter, it is going to eventually die.
Correct.
So if the basic and fundamental principle of social distancing, if it is meticulously followed, then we would be definitely winning over the situation. And there is no harm in keeping safe distance, because this has been
all right. So that's the mantra right now. We all need to follow social distancing, physical distancing for everyone and ourselves. Thank you so much, doctors and our viewers. Bye-bye.